you guys?
Good, yo.
Good.
Dr. Kirsten Meldrum is a pediatric urologist, one of only 700 in the country. She specializes in groin abnormalities and issues like urinary tract infections. Half of her week is spent here in the office. 2 other full days are in surgeries correcting any variety of issues. These include teenagers to newborns.
And then we see lots of babies that they pick up problems prenatally on an ultrasound, developmental problems with the urinary tract that will follow and sometimes need to fix with a surgery.
This little guy is a follow-up for a groin issue that his family doctor wanted a specialist to check out.
And then they were mentioning about the right side not being all the way down.
Yeah, that's what they
Okay.
said after the ultrasound.
Baby seems to be developing just fine, but his parents are worried about a small rash as well.
And he's never seemed to have pain down there at all. And if you notice anything change, come back and see me. But for right now, it looks real normal. So I don't think you have anything too worrisome going on.
Okay.
All right?
Yeah.
The vast majority of urologists work with adults, but Dr. Meldrum knows there's an important need for specialists who work just with kids.
You know, the great thing about kids are they're so resilient. You know, they, when you operate on adults, a lot of times it's hard to motivate them to get out of bed and do what they need to do to recover. And, you know, kids, if they're not out of bed, you know, something's wrong. I mean, they really are up and at them and wanting to go and play and get back to business. And they just recover so nicely. They're just, you know, very resilient and fun to take care of. And obviously, if you have kids, you love working with kids and being around kids. It makes every day kind of fun.
Your donations to Covenant Kids help purchase a special scanner that urologists use on the pediatric floor in the hospital.
It's a kind of a non-invasive way to see if people are emptying their bladder. So sometimes you can have incontinence because you don't empty your bladder all the way. Your bladder's not squeezing well. And a lot of times in patients that have had recent surgery or spinal surgery, their bladder, the nerves, you know, are kind of damaged and the bladder doesn't squeeze well. So it gives you a way to know if they're emptying without catheterizing them and traumatizing them. So it helps you figure out what's going on with the bladder.
Dr. Meldrum is thankful for the donations to Covenant Kids.
It's great. All this equipment helps us do our job, and it's wonderful to have the support, and we're really trying to grow our pediatric program here at Covenant, so any little bit, you know, can help.
This little guy was well behaved during his appointment, but he's ready for the door.
You ready to go? Come on, buddy, we've got a treasure box. See if there might be something in there you like. Nice to meet you guys.
Nice to meet
Take
you.
care.
Thanks a lot.
Yeah.
You want one of these?